The midline filters of the Ridges Plus are of the utmost importance, since they replace the variable space and the air between the legs. This replacement decreases in thickness from the interthighs level down to the legs and the feet, as does the anatomy. Thus, the central sensors, controlling the density of the image, accurately adjust the technique for the legs situated on each side. The interthighs filter has rounded corners so as to clear the puncture site, a pointed and wedged lower end, and an opaque ruler. Wrapping the filter is good and inexpensive protection against blood and proviodine. Two interlegs filters fill the gap between the legs, the thin one, named accessory, and the main one. They are thicker near the knees. A 30-centimeter ruler is also incorporated at the approximate level of the nearby arteries along the midline, allowing an estimation of location, length, and size of lesions. The accessory filter has the same features with depressions for the calves, and it rests on top, easily centered. Both filters permit automatic adjustment of the image density, even where arteries overlay the tibias. The lateral filters contour the ankles, the feet, and the calves. They diminish in thickness toward the feet. In case of doubt as to the position of a filter, look for the arrow indicating the direction of the arterial blood flow. The triangular filter is placed upside down, providing a window of the same shape and axis as the feet. Velcro straps are placed under the midline filters and over the lateral ones, with the velvet facing upward so it will be gentle to the skin. A strip of adhesive tape is very useful to keep the heels touching. The calves fit into the filters. If the heels come apart, flashing appears between the ankles. This is where the adhesive tape comes in handy. And if the filters are too short for the legs, use the extension supplied. Immobilization, especially of the feet, is always important. The trapezoidal cushion steadies the feet at 45 degrees. Cellophane wrapping protects the foam from adhesives and improves hygiene if wrapping is discarded after use. Small prismatic cushions support the lateral aspect of the feet. The material, silicone rubber, absorbs twice as much as water, more than enough to remove halation, so damaging to subtraction. Adhesive bands and Velcro press the filters and legs together, thus preventing vertical and horizontal motion. Careful verification before the injection will ensure better result afterward. Firm immobilization, knees and heels close together, midline centering, precise positioning of the feet, and absence of halation under fluoroscopy. Finally, deposit the interthighs filter either before or after the puncture under the drapes, with its square upper end covering the pubis and its pointed lower end merging with the interlegs filter. Now let us go to North York Branson Hospital in Toronto for a simulated examination thanks to the Chief Radiologist, Dr. Bekai, and to the Technologist, Mrs. Jerry Turner and Dana Zorowski. Recording is continuous.